Hey everyone, it's Casey from MBS Pro. Just want to do a quick little video on a conceptual framework that you might use in the context of increasing your billings. So this is in the context of using MBS Pro, which I'll show you how we do this with this framework in terms of our waiting room, which is a really helpful tool that looks at patients and their billing history, as well as codes that potentially could be billed based on a number of different factors, which I'll cover in a second. This is a first part video to another video I'm going to do, which is, sounds a bit clickbaity, but how to bill $1 million a year. So this is the framework that we'll use to work out exactly what we'll need to do to get to $1 million. I know that sounds really clickbaity, and absolutely the title of the video is going to be how to bill $1 million a year. Super clickbaity, but we'll work through the numbers, the volume that you need to see, and how it all sort of works. So the base framework that you'll need to understand in terms of how to increase your billings is what do we do in terms of patients, in terms of MBS utilization, optimization, and fees per consult. So at its base level, how do you increase your billings? Well, there's two main levers that you can look at pulling. You've got your volume and your value, so revenue per encounter. In terms of your volume, that's pretty straightforward. Essentially, what you're doing is you're either working more hours. So if you're doing 20 hours, you're doing 30 hours. If you're working 30 hours, you're doing 40 hours. That will increase your billings naturally. The other thing is increasing your consults per hour. So if you're seeing, 3 patients an hour at 20-minute appointments, we know that MBS is more valued the shorter time periods that you're offering. So if you go from 3 patients an hour to 4 patients an hour, you increase your billings. This side of the chart is pretty easy to explain, pretty easy to understand. It's just if you do more, you will earn more. There are positives and negatives for that. We know that not all patient care can be siloed within a 10-minute consult. There's a lot of really high value care that takes a longer time, longer than 20 minutes, longer than 30 minutes even, and that sort of care is really important to our healthcare system and really important to a subset of the population that have really complex needs. But again, this is just a conceptual framework, not sort of passing judgment on how anyway practices. I'm just saying if you wanted to earn more, this is how you would do it. So volume is pretty straightforward, either more hours worked or more patients seen per hour worked. In terms of value, this can be optimized quite a bit. We're going to talk more about that in our next video, how to bill $1 million. When we talk about optimizing the value equation, there's a couple of things to think about. So number one, you're thinking about your RPE, so your revenue per encounter. So every time you see a patient, what is the revenue that is derived from that encounter? How do we increase that? The easiest way is charging a private fee. If you're bulk billing in one area, so in the city, your rate or your revenue per encounter is probably something like $60. So your base rate plus your triple bulk billing incentive for a level B, $60. If you then decide to charge $90, you'll earn more. That's pretty straightforward. There are some things to realize and understand about this is if all of a sudden you go from bulk billing 23 to charging $40 or $50 out of pocket cost, your patient demographic is going to change. So it's not going to be as simple as just charging all your patients a fee. Why didn't I think of that earlier? Your patient demographic is going to change. The type of care that you're going to have to offer is going to change. You're going to have to really provide a service that people are willing to pay for. We know that, again, not all patients are willing to pay for all types of care. The type of care that you provide is certainly your own and unique to what you do or the special skills that you have. There are some encounters that definitely have huge private fees and are worth it in the context of the patients. So, for example, skin cancer type care, cosmetics, aesthetic medicine. There are encounters where those practitioners are probably not seeing huge volume but are charging large values per encounter because it's such a niche skill. On the other side of this equation in terms of value is our MBS utilization. So essentially learning to efficiently and effectively use the MBS. That still does increase our revenue per encounter, but it might be done in a way that is advantageous to both the patient and yourself in the context of revenue and out-of-pocket costs. So to give you an example, if you are doing a telehealth or a telephone consult and you call a patient to give them some results and a script, you could give them some results about their CST, and that might come under a sexual and reproductive health item number. And then you might also talk about the scripts that they require for their blood pressure, ask them how their blood pressure has been going at home, and their maybe their exercise, which they were doing, which was part of their care plan or something like that. And then that would be a consult that you might bill a sexual and reproductive health item number and a standard attendance item number. A further optimization for that would be if you were only wanting to charge one private fee for this consult as opposed to two. You charge the private fee for your sexual and reproductive health item number and then bulk bill the standard attendance, which would receive the triple bulk billing incentive. So there are a couple of things like that. Now, where do you learn about this? BFD Education Talks. I host a lot of these and do the weekends with BFD Education as one of the presenters. Otherwise, MBS Pro is the program that we're sort of talking about that can help optimize that within the MBS Planner. So after I've gone through this, I'll show you the MBS Planner, the waiting room, and sort of how it helps with optimization to increase your billings and add value to the patients that you're caring for as well. So in terms of our overall framework, remember there's two ways that we can increase our billing, volume and value. You'll find that within these levers, you might increase one, but that actually might decrease another. You might increase your volume, so you're seeing five patients an hour instead of 3. However, the type of patient that you're seeing is going to change, and therefore that value might change, not necessarily increase either. It could decrease because your demographic, which were happy to pay for your 20-minute consults, have now been changed to a demographic that are happy for quick 10-minute consults, which you may find that you have to bulk bill because they're quicker consults. This is an equation that is not necessarily, increase one or both, and, it's awesome. It's something that is unique to yourself in the way that you practice, but a framework to think about. So it might be that certain types of consults you do bulk bill, for example, and other types of consults you private bill because of a special niche or skill, or it might be that times where you're really busy, you might privately bill, and consults at times where you're not busy, you might bulk bill to change your loading over the day, where you might be, really busy in the morning or after 5 when workers are coming in after they've finished their job, and you privately bill for those consults. Versus the middle of the day where you might have your pensioners and therefore you do your care planning and health assessments and things like that. So there are ways to, optimize all of this. Certainly MBS can help. So I'll show you how the waiting room works with that.